Hey guys, just Nathan here. Just checking in just to do a quick video while I'm out on the road with a few clients today. Probably one of the most common questions we get asked with people with lower back pain is, do I need a scan? Probably one of the most difficult questions to try and answer without having someone in doing a physical consult. But in most cases the answer is often no, you do not need a scan. Research has really found that a lot of the findings that are on MRIs are normal age-related changes and may not correlate to your symptoms. There's a bit of research to suggest that if you do undergo an early MRI in your lower back pain episode, you are much more likely to spend a lot more money on your rehab regardless of the outcome or the level of symptoms that you have at the start. So really in most cases the answer is no, unless you're looking at very particular symptoms that you're trying to correlate to a very specific region. Looking either at, like, for example, a disc bulge or a disc herniation that is causing a nerve root compression, in which case you'll be looking for a specific set of symptoms associated with that. I would say in most cases of people that have been for an MRI, it becomes more of a question of, is there anything in the lower back that could explain these symptoms, rather than I'm looking for this particular diagnosis, and if I find it, I can correlate those symptoms to that. If it's not there, it isn't clinically significant and may not correlate to your symptoms and may not even be important in rehabilitation. I guess where some of those incidental findings could fit in is there is a little bit of research to suggest that the more findings you have on a scan, the more likely you are to have an episode of lower back pain. But that isn't to suggest that that means that you will have an episode in the future. It may just potentially increase your risk. In which case, more often than not, you're looking at maintaining an exercise program, keeping fit, keeping healthy, having a steady exercise plan that you follow, whether that be going to the gym, going out for a walk, running, a team sport like a netball or a basketball or a soccer. Those sorts of things are more than likely going to have a greater preventative effect than the potential increased risk from a few incidental findings on an MRI or a CT would potentially lead to. So I guess in essence, scans aren't the be-all and end-all for lower back pain. Biggest thing is get in. If you have to see a GP to go down some pain relief options, go for it. That's great because it can keep you moving, it can keep you exercising better and can help your recovery. Secondary to that, get in, see a physio, get some assessment, get some hands-on treatment, get you moving a little bit better, and get started on an exercise program. Thanks guys, have a great week.